Hi, my name is Olga. I'm going to be performing the skills video of drawing up insulin. I'm in the appropriate school uniform. I will start off with the skills video of verifying the physician's order, and I will go over the 6 rights of medication: right patient, right dosage, right medication, right route, right time, and right documentation. Next, I will go ahead and verify against MR in the EHR 3 times before giving any medication to my patient. I will go ahead and give my medication to my patient. Basically, a patient is going to be receiving insulin. It's going to come into one form, an injection of the regular, which is 4 units, and then we're going to have the intermediate, which is 8 units, which is going to totalize to 12 units of insulin. I will next gather my supplies here. I will go ahead and knock, enter, and close the door behind me to avoid any HIPAA violations. I will set my supplies here on a clean, dry surface. I will go ahead here and hand hygiene and introduce myself to the patient. Hi, Mrs. Smith. My name is Olga. Can I please verify your first name and your date of birth, please? All right, perfect. As she verifies that, I'm going to go ahead and verify here on her wristband. That's going to be my 2 patient identifications. All right, Miss Smith. Your physician has ordered you medication. You're going to get it in one injection form. It is insulin, regular and intermediate insulin. Do you have any allergies? No allergies? Okay, second time verifying against MR with the medication. All right, so I'm going to go ahead and hand hygiene here, and I'm going to put on my clean gloves on. Okay, so Miss Smith, you're going to be receiving two different insulins within the same injection, which is going to equalize to 12 units. The first insulin that you're going to be receiving is regular insulin. It is a short-acting insulin. It covers basically the mechanism of it is that it draws out glucose from your blood into this cell, and it lowers down your glucose levels. The use of this medication, it covers 30 to 60 minutes before meals. Some of the side effects of any medication would be hunger, shakiness, and anxiety. Also, this medication comes with adverse reactions. We do not want them to occur, so please let us know as soon as possible so we can notify your physician. That could be tingling on licks, tachycardia, seizures. Also, the next medication that you're going to be receiving, it is intermediate NPH. It covers use of insulin half the day, which is a little bit longer than the regular insulin. Some of the side effects would be weight gain, water retention, and seizures. And an adverse reaction, again, we don't want that to occur. So if they do happen, please let us know, and I will notify your physician as soon as possible. We want you to look out for generalized weakness, headache, and confusion. Next, do you have any questions for me? No questions? Okay, third time verifying against MR. All right, so I just want to let you know that upon injection, you might feel a little bit of stinginess and burniness. That is normal. And then I'm going to go ahead and get started. At this point, I'm going to gather the patient's glucose levels, and I'm going to determine the next time of the meal. and obviously verifying against MR with everything. And next, I'm going to go ahead and get started here. I am going to confirm with MR 3 times, but there's going to be many other times that I'm going to have to do so. At this point, I have a nurse here by me. She's going to verify the amounts individually, and then we're going to verify the total amount of 12 units. I'm going to start off by rolling the medication vials. And I'm going to use my alcohol wipes here, and I'm going to wipe the tops of them. Next, what I'm going to do is I'm going to draw up the 8 units of air, and I'm going to inject the air into the intermediate, and then I'm not going to draw up the solution. And then next I'm going to draw up the air of the 4 units of regular, and I'm going to inject that air, and then I'm going to tip it over, and I'm going to inject the 4 units of the insulin. Next, after that, I'm going to draw up the rest of the 8 units of the NPH, which is going to equalize to 8 units of insulin. So I'm going to get started by I'm going to basically get the 8 units of intermediate. Nurse and I verify against the mark 8 units of air for my patient. Just gonna push in the air, not gonna draw up the solution. Then next I'm gonna draw up the 4 units of air of the regular. Nurse and I verify against the mark 4 units of air. I'm going to go ahead and inject that into the regular insulin. And then at this point I can tip it over and I can inject the solution of the regular insulin. I'll tap to remove any bubbles. Nurse and I verify against the mark 4 units of air of insulin. Next, we're gonna get the make sure that we don't mix the 2 medications. So we're gonna get the NPH 8 units, which is gonna totalize to 12 units. Nurse and I verify against MR 12 units of medication for my patient, which is going to be subcutaneously given. Next, I want to go ahead and use the swoop method here. Nurse and I verify against MR 8 units of insulin. As this is ready, my medication is ready to go. If I was going to do this away from the bedside, I would label the medication vial with the patient's name and dosage amount. Thank you.